Radioisotope iodine-131 is used for diagnostic and therapeutical uses in nuclear medicine. It produces ionizing radiation, including majority beta radiation, but a small amount of gamma radiation as well. Use of the iodine-131 as iodine salt maximizes the benefit of the absorption tool of iodine by the cells of the thyroid gland. It can be used in radiation therapy to assist with the destruction of appropriate tissues. Major uses of iodine-131 consist of the treatment of thyrotoxis and particular types of thyroid cancer, which absorb the iodine. It is also used as a radioisotope therapy for hyperactive thyroid nodules. Small doses of iodine-131 are able to lessen activity of the thyroid gland, decreasing the production of hormones within the gland. If thyroid cancer forms, treatment consisting of high doses can be used to treat the cancerous tissue. Iodine-131 isotope is also able to assist as a radioactive label for some pharmaceuticals for remedial uses. For example, iodine-131 metabenzylguidine for diagnostic imaging and treatment of pheochromocytoma and neuroblastoma. During these uses, the iodine-131 uses beta radiation to obliterate the tissue. More radiation occurs by gamma radiation to make sure the tissue is able to be seen during these diagnostic tests and scans, as iodine-131 is also a gamma emitter. Radioactive iodine can also cause thyroid problems. This is a potential risk for patients receiving this treatment and the distributors, as long-term exposure to radioactive iodine can cause nodules or cancer of the thyroid. As well, there are aftercare procedures which have a negative impact on the patient. In order to minimize accidental exposure to others, patients treated with radioactive iodine-131 are encouraged to stay isolated from others and not to hold children whilst the radiation is still high. This is for the first 3 to 5 days. After this time, majority of the excess radiation should have been removed through sweat and excretion. However, patients are still warned not to become pregnant for 6 months after the treatment due to the potential risk to the baby. In addition, recipients of the iodine-131 may trigger radiation detectors at airports if wishing to fly by air for up to 95 days after treatment. Doctors are faced with the challenge of keeping the balance of risks and benefits of this radioisotope. Iodine-131 can destroy cancerous tissue, yet at the same time it can create it. However, its benefits outweigh the problems, as all these risks can be avoided with the appropriate safety measures and precautions being taken at all times. The positive effect of a potentially life-saving treatment is worth the preventable risk of overexposure and a few inconveniences afterwards.